Chapter 7, Psychotherapeutic Drug Therapy. Learning Objectives. Psychotherapeutic drugs are powerful chemicals that produce profound effects on the mind, the emotions, and the body. Psychiatric medications act on the body's nervous systems by altering the delicate chemical balances within the system. Most psychotherapeutic medications interrupt the chemical messenger or the neurotransmitter system within the brain by suppressing major nerve pathways that connect the deeper brain to the frontal lobes and limbic system. The frontal lobes of the brain are the source of higher human functions. Think about love, creativity, planning, critical thinking and judgment, and abstract reasoning. The limbic system, this is responsible for our emotions, motivation, memory, and the sympathetic fight or flight response. The central nervous system is composed of the brain and the spinal cord. Together, they control all the motor and sensory functions of the body. Information travels from the brain down through the spinal cord and reaches the appropriate muscle group and then results in movement. Sensory information like touch or position or temperature, this is relayed in the opposite direction. This comes from the muscles and the body areas up through the spinal cord and then into the brain. Throughout the process, the central nervous system combines all the incoming, the sensory data, and the outgoing or motor data. The autonomic nervous system is responsible for regulating the vital functions of the body. These would be the activities of the heart muscles, smooth muscles, and glandular secretions that are autonomically controlled by this system. The parasympathetic nervous system is designed to conserve energy and provide a balance for the sympathetic system's excitability. The main functions of the parasympathetic system are to monitor and maintain control over the regulatory processes of the body. This is accomplished by governing smooth muscle tone and glandular secretions. There are 4 traditional classes of psychotherapeutic medications: anti-anxiety agents, antidepressants, mood stabilizers, and antipsychotics. 2 newer classes of psychotropic medications are stimulants and anti-obsessive agents. Anxiety is common to everyone, but when it interferes with one's daily ability to function, then it becomes an anxiety disorder. Today, anxiety disorders are a common mental health problem. Anti-anxiety agents are drugs that reduce the psychic tension of stress. They are also referred to as anxiolytics or minor tranquilizers. Indications for use of benzodiazepines are for anxiety, sleep, sedation, and seizure. These are effective and are generally well tolerated, and they do not affect sleeping patterns. Benzodiazepines are prescribed to provide sedation, induce sleep, prevent seizures, and prepare individuals for general anesthesia, but they are mainly used to decrease anxiety. Individuals with anxiety have decreased level of a neurotransmitter that is called the gamma aminobutyric acid. Benzodiazepines act by increasing the GABA activity, which results in decreasing anxiety. They are fast-acting, and the onset of action routinely occurs within 1 hour, and they exert their action or the duration for about 4 to 6 hours. Benzodiazepines are metabolized by the liver and excreted by the kidneys. Side effects of benzodiazepines are routinely minimal, but they may include fatigue, sedation, dizziness, as well as orthostatic hypotension. Orthostatic hypotension is a drop in blood pressure when a patient stands. Buspirone differs from benzodiazepines. First, it belongs to a different chemical class, the azapirones, and it does not cause the sleepiness or muscle relaxation that is associated with benzodiazepines. Second, the therapeutic effects for this are not seen for 3 to 6 weeks after beginning treatment. Buspirone has less potential for abuse. Clients are still cautioned to avoid alcohol. Third, the potential for overdose is lessened because the drug has a wide dosage range. Has decreased side effects, but it does include lightheadedness, dizziness, headache, and nausea. Pregabalin has been introduced to treat several kinds of anxiety disorders, as well as seizures and neuropathic pain. Side effects are fewer than other anti-anxiety drugs. So this will help individuals to be more compliant with their treatment. Anti-anxiety drugs have several drug interactions, including central nervous system depression when they are combined with other central nervous system depressants, such as alcohol and street drugs. The combination can produce serious and even fatal reactions. Concentrations of the cardiac drug digoxin may be increased during treatment with anti-anxiety medications. So patients that take digoxin must be routinely assessed for signs or symptoms of digoxin toxicity. Antacids are not to be taken because they interfere with the absorption of anti-anxiety agents in the bloodstream. Anti-anxiety agents require frequent nursing assessment for therapeutic actions as well as side effects. Mood disorders are known as ineffective emotional states. These range from deep depression to excited elation. They are also called affective disorders because the word affect means emotions. Antidepressants are divided into categories based on their chemical formula. We have tricyclic antidepressants, monoamine oxidase inhibitors known as MAOIs, selective serotonin reuptake inhibitors, SSRIs, atypical depressants, and selective serotonin norepinephrine reuptake inhibitors, or SSNRIs. The physician's first choice for the treatment of depression is often an antidepressant. Antidepressants are also indicated for use with bipolar disorder, panic disorder, obsessive-compulsive disorder, enuresis, bulimia, and neuropathic pain. Antidepressants have been used with success in PTSD, organic mood disorders, attention deficit hyperactivity disorders, and conduct disorders in children. Tricyclic antidepressants will take 2 to 3 weeks to take effect. The side effects may include drowsiness, dry mouth, dizziness, weight gain, impaired sexual functioning. It does treat anxiety, depression, PTSD, and obsessive compulsive disorders. MAOIs are not often prescribed because of serious adverse reactions and interactions with food and drugs. There are strong dietary restrictions with these medications. SSRIs are the first choice for treating anxiety, depression, and other problems. The side effects are gastrointestinal distress, headache, dizziness, sexual dysfunction. Atypical antidepressants, agitation can occur with bupropion. Common side effects would be sleepiness, increased appetite, weight gain, and dizziness. SSNRIs. The side effects for these are nausea, dry mouth, dizziness, sedation, sweating, anorexia, and we need to make sure that we monitor our patient's blood pressure. Clients may attempt suicide while on antidepressants because energy levels increase. Clients need to be routinely monitored for physical and behavioral changes. Individuals experiencing postural hypotension should be protected from falls. Kidney and liver function should also be assessed and monitored monthly. Any signs of toxicity, a headache, stiff neck, or palpitations should be reported to the physician. Special precautions for patients that use MAOIs include no foods containing tyramine. This is because a hypertensive crisis can develop if tyramine-containing foods are ingested. Symptoms of a hypertensive crisis would include severe occipital or temporal headache, sweating, dilated pupils, increase in systolic and diastolic pressure, neck stiffness, and neuromuscular excitation. Medications that need to be avoided when taking MAOIs are prescription and over-the-counter drugs that include nasal and sinus decongestants, cold, allergy, as well as hay fever remedies, inhalants for asthma, weight loss pills, pep pills, stimulants, narcotics, local anesthetics, illicit drugs that include cocaine or any amphetamine. Individuals that take MAOIs need to avoid any alcoholic drinks, any dairy products, think about aged cheese, sour cream. They need to worry about fruits and vegetables, so avocados, bananas, canned figs, any overripe fruit. They cannot eat pickled or smoked meats. So that would include salami and sausage. And they cannot consume large amounts of caffeinated coffee, tea, or cola. They cannot have chocolate, licorice, soy sauce, or yeast. Mania is a state that is characterized by excitement, great elation, over-talkativeness, increased motor activity, fleeting grandiose ideas, as well as agitated behaviors. Some therapists will call mania agitated depression because it frequently occurs with severe depression. Antidepressant medication therapy will help patients cope with their depression, but it has little effect during the manic stage of behavior. Therapy is contraindicated for pregnant women and people that have kidney failure. Clients that have physical health problems must be carefully monitored. Long-term use of lithium can alter thyroid dysfunction or thyroid function, known as hypothyroidism, and can cause the loss of the kidney's ability to concentrate urine. When considering the guidelines to care for patients on lithium, lithium must be taken on at regular intervals every day at the same time. If a dose is missed, the individual should wait until the next day. When the treatment for lithium is started, some side effects that are mild may develop. A fine hand tremor, increased thirst and urination, nausea, diarrhea, constipation. Some foods like celery and butterfat, they may not taste well. Most side effects will decrease over time. Serious side effects for lithium include vomiting, extreme hand tremor, sedation, muscle weakness, and dizziness. Lithium and sodium compete for elimination from the body through the kidneys. An increase in salt intake will increase the lithium elimination, and a decrease in salt intake will decrease lithium elimination. Therefore, it is important that the patient maintain a balanced diet, liquid, and salt intake. There are various situations that can require an adjustment in lithium dosage. If the patient has the addition of a new medication, a new diet, or an illness with fever or excessive sweating. Blood will be drawn for determination of lithium levels in the morning, approximately 8 to 14 hours after the last dose was taken. Lithium values need to be monitored every 1 to 3 months for therapeutic level. The thyroid function and kidney function need to be monitored every month. And the lab values that we watch for kidney function are the BUN and the creatinine. Antipsychotics are also known as major tranquilizers or neuroleptics. Most antipsychotic medications are available in tablet, liquid, as well as injectable forms. Every class of antipsychotics has profound effects on the most complex systems of the body, which is the brain and the nervous system. The psychosis called schizophrenia is associated with two groups of symptoms. Type 1, which are called positive schizophrenic symptoms, and type 2, which are called negative schizophrenic symptoms. Antipsychotic medications appear to be more effective in controlling the positive symptoms of acute schizophrenia. There are various central nervous system side effects of antipsychotic or neuroleptic drug therapy. One may have extrapyramidal side effects. These are defined as abnormal movements produced by an imbalance of the neurotransmitters in the brain. These side effects can progress to a permanent condition known as tardive dyskinesia. Decreasing the dose or switching to an atypical antipsychotic may help decrease the symptoms. The peripheral nervous system side effects include dry mouth, blurred vision, photophobia, tachycardia, and hypotension. Caregivers need to protect the individuals from falls during the first few weeks of therapy because there is a good chance for low blood pressure or hypotension when patients stand up or change positions suddenly. Hypotensive episodes can cause tachycardia because the body will attempt to adapt to the lower blood pressure. Antipsychotic drugs affect each person differently. They are powerful medications that need to be administered carefully. Side effects and adverse effects to antipsychotic medications are numerous. These antipsychotic medications can interact with many other chemicals. So antacids will hinder the absorption of antipsychotics. Therefore, antacids must be administered 2 hours after the psychotic. Alcohol, anti-anxiety meds, antihistamines, antidepressants, and morphine will produce severe central nervous system depression when mixed with antipsychotics. The SSRI antidepressants are often used to treat obsessive compulsive disorders. Some that may sound familiar may be Zoloft, Prozac, or Paxil. These stimulants are used to treat people that have ADHD. Nurses and anyone that administers psychotherapeutic medications have 5 basic responsibilities that's related to these medications. The patients must be assessed, the care must be coordinated, the medications must be administered, client responses must be monitored and evaluated, and the clients must be taught about their medication. Each area of responsibility involves careful observation and the understanding of each drug's therapeutic as well as adverse actions. Nurses are responsible for clients' education. We know as nurses that individuals that are well informed and their families are better able to cope having adequate knowledge and information. Healthcare providers, especially the nurses, must remain vigilant for the effects of the psychotherapeutic medications. Clients that take psychotropic drugs, especially antipsychotics, are at risk for developing serious problems of neuroleptic malignant syndrome and tardive dyskinesia. An accurate identification of signs and symptoms of each of these will help prevent many complications. An informed decision made by a client not to follow a prescribed treatment program defines noncompliance. Many psychiatric clients choose to discontinue or reduce their medications because of the distressing side effects. Some of the individuals have difficulty following the treatment programs because of their own mental problems. The key to improving the client compliance are education and an effective client-caregiver relationship. Nurses should work with their clients to find and eliminate factors that may lead to their noncompliance. The medication routine should be simple if possible. And we also want to make sure that our individuals are taught about and monitor themselves for side effects and adverse reactions. An informed consent is the process of presenting clients with information about benefits, risks, and side effects of treatments. This enables the clients to make voluntary and knowledgeable decisions about their care. When treating physical disorders, the process is very straightforward. Treatments are described, and the patient or client makes the decision to either accept or reject the plan. However, with mental disorders, it is not as clear. In the past, clients were often considered a danger to themselves, or others were routinely medicated without their consent. Today, there are new drugs being developed, and ones that act more specifically on this specific area have a shorter onset and produce less side effects.